Hello, my name is Dr. Corine Cicchetti, and I am the Chief Medical Officer for Resilie Cosmetics. I'm here today to talk to you a little bit about myself, about how I became affiliated with Resilie Cosmetics, and more importantly, about the groundbreaking research study that we just did using exosomes. So I am a board-certified physician in the area of rehabilitation medicine, and I have been practicing for the last 15 years. About 9 years ago, I really got more involved with regenerative medicine, and that involved mainly PRP and stem cell therapy, and I was really seeing amazing results with my patients. So I decided more recently to open up a second practice with a focus on regenerative medicine, as well as aesthetics, which has become another one of my passions. So my first introduction to exosomes was actually because I began using microneedling as well as radiofrequency microneedling in my aesthetic practice, and was using topical exosomes that were available from another company to help promote healing and minimize downtime. Over the pandemic, a lot of the labs that produced Wharton's jelly stem cells were actually shut down by the FDA for a number of reasons, mostly because they were not compliant with FDA regulations. It was very important to me that I had high quality cells from a clean lab and to also have full transparency from the company. At that point, I did a large search to try to find another company, which was very difficult at that point. And I met with Erin Crowley, as well as her father, Mike Crowley, and I was very impressed with them as well as their product, and I decided to start using their products right away. Exosomes over the last couple years have exploded onto the market. There are several different companies with different doses and different sources, all making claims that they are the best out there. Some are from Wharton's jelly, some are from adipose tissue, and it's hard to know as a consumer which is the best. I personally was not happy with the exosomes that I was using. I was getting results from them, but I did not care for the consistency of the product, and I did not care for the scent. The product that I was using was also lyophilized, and I questioned the viability of the exosomes in that product. So when I was able to actually get exosomes from Resilie, they were Wharton's jelly, Age Zero Exosomes in saline. They were easy to use, and I still got amazing results. So I immediately switched over to solely using Resilie exosomes. So as a physician, the things that were important to me were, number one, I want to use the best-in-class exosomes. I want to be sure that the exosomes have adequate quality testing. They obviously need to be easy to use and easy to store in my office. I was looking for full transparency from the company as well as a reasonable price point. Resilie met all of the above requirements. They also had multiple doses, 5 billion, 10 billion, 50 billion, 100 billion, so I could use whatever dose that I want. However, that leads us to the question, how many exosomes do we really need to get a superior outcome? Nobody has ever really looked at this. We do know that microneedling is a highly effective procedure. It has been studied in the literature. And we know that using topical exosomes do minimize downtime, and they improve the outcome of the treatment through a variety of ways. But there's never really been a study to quantify the number of exosomes that are needed. And really, the doses from all the other companies seem to be arbitrary. They are all over the place. So we set out to collaborate on the first ever study assessing topical exosome dosing combined with microneedling. And I became the principal investigator for this study. So our study design was fairly simple. We used women ages 35 to 60 years of age initially. Over time, we did include some male participants as well, but primarily it was women. We used the skin pen, which I have at my office, and subsequently we also included the Rejuva pen. Many offices do not have the skin pen, but Rejuva pen is also an FDA-approved device. So we did mandate that any clinics that participated in our study use one of those two devices. Patients were scheduled for 3 treatments about 4 weeks apart, and they were randomized to one of 3 groups, a 5 billion, a 50 billion, and a 100 billion group. Now, it is important to know that we did not have a control group for the study. We did not have an only microneedling group. we know that the microneedling already is effective. And it's been shown in the literature that exosomes do help with wound healing of the skin. And that's essentially what we're doing with microneedling. We're creating a wound to the skin, a controlled wound, and the exosomes are used to then heal. So we are really assessing the difference between the exosome groups, not the effectiveness of the microneedling itself. So we had questionnaires to be filled out at each visit when patients came in, and then they were also to fill out questionnaires at 72 hours post-treatment. Final results are at 6 months from their first treatment, and at that point we would take final pictures to assess their outcome and do a final questionnaire. Our exclusion criteria really are the exclusion criteria for general microneedling. There are no exclusion criteria for topical exosomes themselves, so this would be criteria for just the microneedling. So that would include having active skin cancer in the treatment area, having open wounds, sores, or irritated skin, have an allergy to stainless steel or an anesthetic, as we do numb the skin prior to the procedure, have a bleeding disorder, are pregnant or nursing, or are taking a drug such as Accutane. So the study commenced at my office, Buffalo Regenerative Medicine and Aesthetics, and we subsequently opened it up to other practices that wanted to participate. So we now have a total of 5 practices with a total of 98 participants. We started in May of this year, and so we are yet to obtain all of our 6-month data, as it will be coming in actually this month. We plan to have all of our final pictures reviewed by an independent dermatologist for further analysis as well. So we do have some preliminary results to share with you, and these results are really lumped results from all the groups because we do not have that 6-month final data. It is hard to really show you the results between the 3 treatment groups, so we are just showing you the effect of all of the groups together. 84% of patients noted improvement of skin texture. Now, we would normally see some improvement of skin texture with just standard microneedling without exosomes, but 84% of patients noting improvement of skin texture is actually quite high. And improvement of skin firmness, 88% of patients noted this. This is not something we would typically see with standard microneedling, so we were very surprised to see this result. We also asked patients about improvement of skin radiance, and about 80% of patients noted improvement of radiance of their skin. Being in aesthetics, hyperpigmentation is one of the most difficult things to treat. However, 70% of patients actually noted improvement of hyperpigmentation after their treatments. 77.3% of patients noted improvement of wrinkles and fine lines, which is also wonderful results. We do typically see some improvement with fine lines from standard microneedling, but in terms of wrinkles and this high percentage, this is a phenomenal result. We also asked them about improvement of visible pores, so a decrease in pore size, and 68% of patients noted a decrease in visible pores. We also asked patients if they felt that the exosome treatment improved their skin quality and appearance after their 3rd treatment. And an overwhelming 77% of patients noted that they did have improvement of quality and appearance. And we also asked them if they felt that the treatment increased their self-esteem as a result of the treatment, and 63% said yes. We also assessed redness reduction in this study. So we asked patients on a scale from 1 to 5 if their speed of redness reduction using resilie exosomes was improved compared to microneedling without exosomes. And a fair number of our patients had had standard microneedling previously without exosomes. So we were able to obtain some good data from this. We know that using standard microneedling, patients will note redness for 48 to 72 hours after procedure. And you can see here that many of our patients noted a significant reduction in the amount of time that they had redness after the procedure. And I will tell you that some patients reported a decrease in redness within 4 hours after their procedure, with the majority stating that their redness decreased within the first 24 hours. So let's look at testimonies. So I will tell you that overwhelmingly, my patients in our practice had great results and were raving about their results to us. And these were testimonies that they actually wrote, not to me, but they wrote on the questionnaires. So this is a 51-year-old woman who stated that my overall appearance of my skin with makeup and without has me loving my skin. One of my main goals was to be able to wear makeup and feel comfortable doing so, maybe only with a tinted moisturizer. This is amazing. This patient, who is 41, said, I loved this treatment and have seen a noticeable difference in my skin. I look more radiant, younger, and well-rested, even when I'm not. I've needed less makeup since starting this treatment, and I've received several compliments from friends and family as well. And this patient, who's 35, said, after the first treatment, I saw a big improvement in the texture and brightness of my skin. For the first time in my life, I left my house without makeup. That's an amazing testimony. We do have some before and after photos to share with you. A couple patients who have completed all 3 treatments here. This patient is the same patient in both of these pictures. Pre-treatment is to the left and post-treatment is to the right. You can see to the left that she had a large area of hyperpigmentation down by her chin and her mouth, and you can see that reduction in hyperpigmentation very well in her post picture. Same thing on her forehead. She had a large area of hyperpigmentation due to melasma on her forehead, and that was significantly decreased post-treatment after the 3rd treatment. This patient here suffered from a great deal of acne scarring, and you can see from her first picture to her post-3rd treatment picture, she had a significant improvement of her scarring and overall skin texture. This patient as well completed 3 treatments. This is where you can start seeing that firmness of the skin. You can see that it actually looks like her cheek has lifted, her lines are better, her texture is better, and she also had a decrease in that hyperpigmentation as well on her skin. These 2 patients were pictures after their 2nd treatment, but you can see the patient on the left, she has had an overall improvement of texture as well as improvement of firmness of her skin as well, with less visibility of those fine lines, particularly around her mouth. And same thing with the patient on the right. You can see her overall texture and appearance of her skin is improved. These are the results that we have thus far for the study. We obviously will be getting a lot more information in the coming months, and we are excited to share those with you once those results have been analyzed, and we do have our dermatologist review those pictures. We are very excited to move forward with sharing all of those results with you and with the public. I personally have used these exosomes on myself, on my family members, and have used them on hundreds of patients in my clinic, and I can't speak enough about the results that I am seeing from these exosomes. So I challenge all of you out there to also try using them in your practice. Thank you very much.